What's the difference between health risk and safety risk? Well, it's not difficult to spot a safety risk, is it? Getting a wheelchair onto a train has obvious safety risks, but that surely is a health risk. Brenda, you've just been off with back problems. We don't want to do your back again. Get some help, will you?
It's all right. This is a lighter version. It's fine.
Well, anyway, that still could be a health risk. Al, is this yours? Working here without a hard hat is a safety risk, but you can get vibration-white fingers from the use of tools like this. Now that is a health risk. So, maybe you should share that work with someone else, man.
You're like my girlfriend, you are. Knock, knock, knock.
You try to help. Right. Now the lads are on top of it. Give it an hour. Identifying health risks isn't rocket science, but it does need input from colleagues across the business. And that really is the point. Knowing you can call on skills from other departments. People that fill posture. That's painful to watch, that is.
Posture? I'm up to my eyeballs in deadlines here. The phone never stops ringing.
And that, my friends, is stress with a capital H for heart attack. It's about anticipating, planning ahead. Drivers are expected to be on top of their game. And most don't complain about the responsibility, but well, if the seat, well, if that's not right, what do you expect? After a while, that's when you start to notice it. Could be the chair or maybe back problems. These aren't safety issues, but it could be a health risk. Now here's a place that definitely offers some health risks. We tend to think about safety risks first, but health risk is just as important. With all the oil, chemicals and other fumes floating about, how clean is the air? Oh, Andy, long day.
As usual, off in a minute though. Yeah, if it gets too much, I'll pop outside for a breath of fresh air.
Very sensible. It may mean nothing, but it doesn't hurt to check. That is what health risk is all about. There are many other health risks all around us. Whether it's vibration, noise, stress, working with other departments, and supported by this simple guidance. Make assessing health risk part of your long-term planning.
Line managers don't need to be technical experts in the field of health and well-being. What they are required to do, and you're required to do, is to understand the tasks that your workers are required to undertake as part of their duties. And then with the simple application of tools and assessments that we're going to discuss and outline in this briefing, you can then understand how to assess the risks and potentially well-being issues to which your staff are exposed. It's basically about formalising a degree of common sense. The aims of this session are very straightforward. The first is to identify and discuss the three main aspects of health and well-being assessment. We will also understand the simple step-by-step process that you as a line manager will be required to follow in assessing workplace risk. And by doing this, we recognise the practical things we can do that can protect and enhance the health and well-being of ourselves and others we work with. Just standing back and taking a fresh look at things can often mean we can find quicker, smarter and healthier ways of working that cost nothing other than a thought and willingness to help. It's very easy to understand that working on the railway, the health and well-being of an individual can have a direct effect on their ability to do their job. However, it needs to be equally well understood that their job can have an effect on their long-term health and well-being. So carrying out a health and well-being assessment helps us understand our workplace and the people within it in order to make it a better place to work. The role of the line manager is vital. You have the most experience of managing everyday tasks. If you don't identify and raise issues, there is a chance they may be missed altogether. Let's take a look at a few examples of typical health and well-being issues that are relevant in today's railway.
The hazards associated with the welding aspect of it, we are looking at the health hazards of the fumes given off. And what fumes are given off? You know, we know the makeup of the rail has got all sorts of different components in there, but when you're adding something to it by the metal within the rods when you're welding, does that react with the metal that's in the rail, with the iron, or is it going to give off a different fume or different component that we're not sure of? So, well, the main issues we're going to have is with respiratory illnesses. I think that's the main thing we need to be looking at here.
One of the main health risks for my workforce is from work-related stress. Now, all this research shows that work is good for you. Work pressure is good for you. In fact, work pressure will never go away. When we talk about work-related stress, what we're actually talking about is making sure that those pressures never get to the point where they're causing ill health symptoms. In other words, we don't want things to tip over into ill health.
Our biggest health risk currently with multi-purpose stone blowers are the fact that we have a number of safety issues which lead into the health problems. We have to wear hard hats, we have to wear eye protection, we have to wear dust protection, and we have to wear noise protection. So as a result of that, we have health issues relating to dust, noise, and objects. Our biggest issue was that many years ago, we'd done a vast amount of noise assessment, which actually said we weren't doing too bad from a safety point of view. Okay, but it was only when one of our guys went for a medical, his driver's medical, and he came back with a reduction in his hearing capacity, did we think that we've now got a bigger issue here? What's going wrong? So we went back and reviewed what we did then, and we found that although we'd come up with some PPE, I solved the safety issue, the PPE was wrong for the task. And the guys, when they're out on the machine, have to wear a communication kit, as well as wearing eye protection and headwear. Coupled with dust, as a result of blowing stone into the ground, dust comes up, another health issue. We've now got a guy that dresses up in a spacesuit.
We've got multiple health risks. We obviously have lots of people using tools that have vibrations, that have noise. We have people who may be going out and becoming exposed to asbestos or lead potentially. And then we also have health opportunities, which are we recognise that people aren't necessarily as active as they could be, that there are higher levels of stress than are necessary for good performance, and that people's diets, their recovery, their sleep, again, all have areas of development. So I think it's we tend to look at it as opportunities rather than risks in those areas.
Well, clearly with train crew, people, especially drivers, are in a fairly confined space in a train cab and on a train seat for a considerable number of hours each day and for several days at a time. And sitting anywhere in that space and having to reach for various controls, etc., has its difficulties and presents some people with some issues.
There's occupational health risks really, regarding working with chemicals, there's manual handling, there's stress, there's hand-down vibration, there's noise, it's quite a big heavy industry out there.
It can start from the point of referral, so a manager has identified that there's a health issue with the individual, and this can either be that they've come absent from work, either short-term or long-term. It can be that they notice there's a change in the way that they're able to do their job role and their tasks at work. It could be a change in behaviour. So the first thing that the manager would do would be to send a management referral online to the occupational health team, where upon receipt an appointment will be made to be assessed by one of the clinicians.
So what is health and well-being assessment? There are three main aspects to health and well-being assessment. Looking at diagram 1 opposite, you'll see that the three main elements relating to the workplace have been represented by the coloured circles. It's the overlap of each adjacent pair of circles that represents the key areas for managers to focus on in relation to health and well-being assessment. Let's take a closer look at these. On initial inspection, this may appear complex, but the aim of health and well-being assessment is to follow a simple process to identify health hazards in the workplace, assess potential risks to health, and determine appropriate ways of informing others. This needs to be focused on protecting and, where possible, enhancing the health and well-being of people we work with. It's very important to be aware that you are not needing to tackle these issues alone. In fact, you'll achieve much better results by working alongside others, especially with someone who works in the environment concerned on a day-to-day basis. Health and well-being assessment needs to be a partnership between managers, frontline workers, and occupational health advisors, each bringing their knowledge, experience, and skills to support the process. The first overlap seen here is between the individual and the job. We need to assess the job activities. By this, we mean looking at the impact of activities relevant to a number of workers carrying out similar tasks. The second overlap is between the individual and the organisation. We need to assure individual fitness by looking at helping an individual continue working within their own capabilities and circumstances. And the third overlap between the organisation and the job itself suggests we protect and enhance employee well-being. This could be looking at helping understand psychological issues, working conditions, and helping reduce undue stresses as far as possible. So it's these areas that we need to be aware of, monitor, and be prepared to respond to in our daily working lives. When you apply a health and well-being assessment in your workplace, it's useful to have these in mind. Now take some time to consider your own circumstances at work and think about examples that relate to each of the three areas we have just discussed. We will now look at the simple process that can help us clarify an issue as well as identifying how it can be solved. The starting point for identifying the need may be proactive, in that it's either a new activity or a planned review, or it might be reactive in that an individual has reported an issue, or it may be due to an incident or accident. From there, we can look further into the issue in a systematic way. The diagram here sets out a simple, common sense, 5-step set of questions for us to answer. Following this process, a step at a time, can help us clarify an issue as well as identifying how it can be resolved. Firstly, what are the health issues? We need to understand what people do, what they're exposed to, and how this may affect their health and well-being. Secondly, who does this apply to? Clarify who might be affected by the health issues and the effect it may have. Third, how serious is it? Evaluate the risks and consider both the consequences and the frequency, and then decide whether there is a need for additional action. Fourth, what needs to be done? Decide what needs to be done about the issue. Think about the controls you have in place and how the work is organised. Compare this with good practice and see if there's more that can be done. Make sure you record your assessment. And finally, are the controls working? Regularly review the assessment and controls and update if necessary. This may be due to plan change, review timescales, or something else that's altered. Taking the first step, we consider what are the health risks. Here we aim to consciously look around and identify issues that may adversely affect the health and well-being of people in the workplace. It is important that we are able to stand back from time to time and view things that are going on from a wider perspective, whilst holding the aim of improving the health and well-being of our people firmly in mind. There are a number of practical things that you can do. Set time aside to look at what health issues may be affecting your workplace. Look at things you're used to seeing through fresh eyes. Put yourself in someone else's shoes. This technique can help see things that have become unconscious or invisible because we're so used to seeing them. Consciously look out for early signs of ill health caused by work. Bear in mind that some health conditions may take a long time to show. Listen to what the people around you say. Sometimes it's worth picking up on somebody's throwaway line to see if there is more to something than initially meets the eye. Appreciate that some issues may have been around for a long time and may seem difficult to solve, but they are present and need to be recognised. Other thoughts and consideration. Walk around the workplace and talk to people that work there. Discussion and insight from trusted and experienced employees can often be very revealing. Liaise with your specialist health and safety managers for advice and to look at generic risk assessments carried out for the activities concerned. Have a look back at your accident and ill health records. These often help to identify the less obvious hazards. Remember to consider that long-term exposure to minor hazards can be far more serious compared to occasional exposure, for example, high levels of noise or exposure to harmful substances. The second step is considering who this applies to. We need to consider the scale of a health and well-being issue and also who might be affected over a period of time. However, when we have learnt about a health and well-being issue, it is important we consider whether it's an isolated case or if it is likely to apply to others as well. A few practical things you can do are: if an issue has been identified through an individual matter, consider whether it may also apply to others carrying out similar work. If you share your workplace, think about how your work affects others, as well as how their work affects your people. Talk to them and ask your people if they can think of anyone you may have missed. Keep talking to people. It is better to talk through issues and make a few mistakes rather than ignore problems. Listen to issues raised and understand the problem before worrying about how to resolve it. Other thoughts and issues are that if looking at a group issue, are certain individuals more vulnerable? Remember that the most vulnerable people, particularly those with existing health conditions or expectant mothers, for example, are more likely to suffer harm and will therefore need greater protection from it. Next, we consider how serious the issue is. Here we aim to recognise and evaluate the implications of what is happening so we can respond in an appropriate and timely manner. It is important to make sure we look into the issue in enough depth so we can make good decisions and move forward in a manner that is reasonable rather than doing too much or not enough. Practical things you can do in considering the seriousness of the issue are: if you are not sure how serious something is, you have the option to seek the help of specialists through the relevant department of your organisation, such as your occupational health hygienists, health and safety representatives, or search on the internet, or review documents that are available to you within your organisation, or you can talk to others. Are there examples of good or useful practice? Other things you can do: speak about the issue to people doing the work to understand what's going on. Keep gathering information until it becomes clear how you should act. Make decisions based upon the information you have in front of you. Consider whether you need to action some quick fixes to protect people whilst longer-term solutions are considered. And consider whether the work environment can be improved so that it becomes a more enjoyable place of work. Critically, we then consider the fourth step: what needs to be done. Aim to take action that is realistic, achievable and effective in improving the health and well-being of our people. Look at what is already happening. Think about the things that are in place and how the work is organised. We can then compare this with common sense and any known good practice. This will enable us to see if there's more that can be done. Here are just a few of the practical things you can do. Share what you've found with those that need to know, such as other employees and safety reps. Get others involved with deciding the best way forward. You could create an informal team with mixed experience and perspectives to help talk through practical ideas and options. Prioritise what needs to be done. Take account of practicalities and legal obligations. Imagine what it will look like if the changes are working well. Mentally rehearse ideas for solutions along with their long-term implications through discussion with others concerned. Manage expectations of those involved or concerned. it is more likely to be evolution rather than revolution. And write down an outline plan using each of the 5 steps as a heading. Other thoughts and considerations. Can we get rid of the issue altogether? If not, how can we control the issue so that any potential harm is minimised? In the case of issues that are undermining well-being, such as stress, it is often most useful for those experiencing the issue to suggest ways the pressure can be reduced to a sustainable level. And finally, within any plan, you may find you need to have temporary quick fixes as well as solutions that may take longer to put in place. Many health and well-being controls are long-term issues. However, we need to assess whether what we're doing is working. Aim to review what you have done so that you can better understand what has worked well, what can be improved, and what may need changing in the future. After taking action to implement changes to address a health and well-being issue, it is important to take a little time to look back on whether our plan worked in practice. Examples of the practical things you can do are: check progress against your plan from step 4, keep an eye on the effect of any changes made. It can be useful to set yourself a reminder on your calendar or phone. Other thoughts and considerations could be: add in health and well-being assessment checks that can be carried out at the same time as other company procedures, such as planned inspections. Be prepared to adapt and improve the plan to accommodate practical experience. Reviewing the health and well-being assessments annually will make sure we're still improving, or at least not sliding back. So in conclusion, when it comes to using the 5 steps within the organisation, how much effort each step takes will depend upon the difficulty of managing the issue identified. It may be that for simple issues, the 5 steps can be carried out by a few people without much effort. But for more complex issues, it may be it will take a number of colleagues to work together to resolve the issue. Either way, the line manager's role is vital to start the process off. Within the 5-step process, it is really the first 2 steps where line managers make all the difference. The other steps may or may not need other people, but if the line manager does not initiate the process, the organisation will struggle to address its weaknesses. If you do nothing else, be aware of your important role in steps 1 and 2 of the health and well-being assessment process, and be prepared to start them off. As we mentioned earlier, the role of the line manager is key. It's you that has the most experience of everyday tasks.